Okay. So, hi, evening friends, evening everybody, bache, evening everybody. So, I guess we know each other pretty well. I'm Dr. Sushant Soni, MBBS MMC, MD Pathology, Resident Hemato-Oncology, AIMS Delhi. I know हमेशा बोलते हुए मुझे ये चीज़ अच्छी लगती है because degrees matter. They are hard earned. So today was our Rajasthan MO exam, a paper that was actually extremely close to my heart. Few of my very close friends gave this paper. Yes, I want them to be successful, but we do not know what God has in store, and have faith. The whole dental segment, I always say this, that the number of seats both in the MDS exam, in the actual paper, as well as in the Rajasthan MO, the number of seats are less. You guys are good, and God has wonderful plans for you. So do not overthink on anything. Let's quickly have a look at the questions associated. With respect to path and micro, total there were 100 questions, out of which 13 questions approximately were from path and micro. So the overall, another glimpse, total medical questions were 22, 78 were dental. So these are the exact questions which have been asked in the paper. Keep on telling me the answers fatafat se. As such, all were from notes, and I love to say this, but had a 100% strike rate. So let us start. Let us start with our first question, which is associated with Kaposi sarcoma. Kaposi sarcoma, which it is associated with HHV8, human herpes virus 8. You know that HHV8 is associated with three diseases: Kaposi sarcoma, primary effusion lymphoma, Kaposi sarcoma, primary effusion lymphoma, and Castleman disease. This was recent NEET PG PYQ also. So it was asked in our Rajasthan MO exam, which is associated with Kaposi sarcoma HHV. On the other hand, Epstein-Barr virus EBV is associated with nasopharyngeal carcinoma. Extremely important, repeatedly asked. Nasopharyngeal carcinoma, Hodgkin's lymphoma, and non-Hodgkin's lymphoma also. Which non-Hodgkin's? That is Burkitt's lymphoma. So answer to our question was HHV8, human herpes virus 8. Next question. Next question. For the diagnosis of salivary gland tumor. Asha, one more thing. I'll keep the discussion of this paper in such a manner that you should be able to, if you're sitting in the paper, you should be able to attempt the answers. I'll not get into the extra nitty-gritties and all. I'm sure we will have a separate day for that. The paper was today, that is on 18th July, 9 to 11 a.m. I know that the emotions are running very high today, but we are in this together. So this gets us to, for the diagnosis of salivary gland tumor, which is a salivary gland tumor, the investigation of choice is FNAC. FNAC should be performed. I will not start resecting the whole tumor. If it is benign tumor, I need not even resect it. If it is malignancy, if it has spread and so on, so I'll need to check. Investigation of choice, FNAC. I'll just insert a needle, take out few cells and know what the diagnosis is. Next question. Unilateral vesicular eruptions. The examiner clearly told you. Please keep on telling me the answers in the chat box. Unilateral vesicular eruptions along the course of the nerve in orofacial region. In all my classes, I usually show this image only. This is unilateral eruptions on one side of the skull, on one side of the orofacial region. They are associated with herpes zoster. This is what herpes zoster looks like. Herpes zoster ophthalmicus. Next question. Both vitamin K and vitamin C, though this is a question from biochemistry also, but both of them are involved in post-translational modifications. DNA to RNA transcription, RNA to protein synthesis, translation. After proteins have formed, post-translational modification is performed by which vitamins? Vitamin K and C. On the other hand, which vitamins are antioxidant? That is vitamins A, C and E. Girls, which you know this well, all your creams which are so expensive, they have which vitamins? Vitamins A, C and E. Next, clotting factors is by vitamin K. Which are the vitamin K dependent clotting factors? So there were two questions on vitamins. It was asked today only. Vitamin K dependent are coagulation factors 2, 7, 9, 10. Coagulation factors 2, 7, 9, 10. You know that. Next, the predominant immunoglobulin in saliva. Which is the, so all the examiner was asking you was, which is the secretory immunoglobulin? Which is the secretory immunoglobulin? IgA. Versus which immunoglobulin? Recent NEET PG PYQ, so for the juniors also can very well be asked in your paper. Which immunoglobulin is present in multiple myeloma? IgG. It shows the presence of gamma globulins. IgG. Which is the most common immunoglobulin in the body? IgG. Which is the most common protein in the body? Albumin. Most common protein in the body? Albumin. You know this. So when we are doing questions, it is not only about knowing these answers, but for the juniors, bache, three things which are absolutely necessary for success. Making your own notes. Very, very important. I am orthodox. I know in Bhatias we give you printed notes, we give you everything. But when you write with your own hand in class, you will remember that you wrote it on upper left hand side, right hand side, lower down, and so on. It has photographic memory. Next, revision of those notes. Multiple revisions are the key to success. Questions are going to come from notes only, no doubt. I'm gonna show it to you. This time in INI exam, we had 23 questions from path and micro. I mean, crazy. There were 17 questions from fungi only, all from notes. Notes are the key to success. And of course, solving MCQs after revision of the notes, because there's a lot of difference between having knowledge and marking the answer right. So these are the three things which are needed. And of course, having faith in God, that is doing good things in life, like giving chocolates to faculties and being good with people whom you love. But coming back, this gets us to our next question. Please give me a like or give me a heart or comment if you are comfortable with all the questions till now. Next, warfarin anticoagulant inhibits. Suppose I have no idea about warfarin also. I have no idea. I do not know that it inhibits vitamin K. But suppose मुझे नहीं पता, then also just by reading the options, I know vitamins 2 coagulation factors, clotting factors 279, 27910 are the ones which are vitamin K dependent. So I'll mark the answer as 4. These are the vitamin K dependent coagulation factors. So there were two questions on vitamins: post-translational modification and vitamin K dependent coagulation factors 27910. Remember that bleeding disorder table, the intrinsic and the extrinsic pathway. I am saying this for all the juniors also. We made that whole table of intrinsic and the extrinsic pathway, which in turn goes to the common pathway. Please have a very good look at this bleeding disorder chart. Which is the first coagulation factor involved in common pathway? Factor 10, which is converted to activated form of factor 10, 10A, which needs three things. I'm just writing this because I have a strong hunch that this will be asked in your NEET MDS this year. It needs three things, that is calcium, phospholipids, and factor 5. Do not go wrong in this. Activated form of factor 10 converts prothrombin to thrombin, which in turn converts fibrinogen to fibrin. End result is formation of fibrin clot. Test for evaluation of extrinsic pathway is PT, prothrombin time. Test for intrinsic pathway is PTTK. Partial thromboplastin time with Qulin, PTTK or APTT. Doesn't matter, but you are going to get a question from this in your next paper. Next question. I actually had a fight with my friend over this question because she so stupidly went wrong in this. I mean, simple, straightforward, binding of complement to bacterial cell surface. What is complement doing to the bacterial cell surface? I want you guys to comment on this because this is a question जिस पे आज ही मेरा पंगा हुआ है. So I want you guys to comment. Binding of complement to bacterial cell surface. This is called as opsonization. What is opsonization agents? They are the substances. They are the substances which make bacteria tasty for phagocytosis, which make the bacteria tasty. So what is complement doing? It is making the bacteria tasty. Which are the opsonization agents? They are which complement protein? C3b. Mannose. What is making the bacteria tasty? It is mannose on bacterial cell wall. Fc fragment of IgG. Fc fragment of immunoglobulin G, IgG. CRP, C-reactive proteins, CRP and fibrinogen. CRP and fibrinogen. These are the opsonization agents. Versus Chemotactic agents. Let me put a line and write this here only. We cannot afford to go wrong in opsonization versus chemotactic agents, which are which complement protein? C5a, leukotriene B4, LTB4, leukotriene B4, interleukin 1, interleukin 8, and uh, interleukin 1, interleukin 8. That is it. These are the chemotactic agents. C5a, which C3a, 3b, 5a, 5b, C5a, leukotriene B4, interleukin 1, interleukin 8, and TNF alpha, tumor necrosis factor alpha. So there is no way we will go wrong between opsonization agents and chemotactic agents. Complement attaching to bacterial cell surface is called opsonization. Next question. Next question. Nephrotic syndrome. There are two types. We can divide renal diseases into two types, nephrotic versus nephritic. Massive proteinuria, in turn leading to edema, hypoalbuminemia, which is the first protein to be lost, albumin, hypoalbuminemia, and hyperlipidemia, along with lipiduria. Lipids are increasing in blood, hyperlipidemia, so it comes in urine, lipiduria. This is nephrotic. This is nephrotic versus nephritic syndrome. Versus nephritic syndrome, which is associated with mild protein loss in urine, mild protein loss with hypertension and hematuria. So I can safely say hypertension is a feature of nephritic syndrome, not nephrotic. Next question, which of the following is a DNA virus? But all hepatitis are RNA viruses except hepatitis B virus, which is a DNA virus. All others are RNA viruses. Last time's NEET MDS PYQ, there was a question on hepatitis B virus serology. So in hepatitis B is very, very important. We'll be discussing the serology of the same also, totally in a separate topic, not today. Let us just have a look at the master table of hepatitis. It is of 5 types, A, B, C, D, E. We have already seen that hepatitis B is a partially circular. It is a partially circular double-stranded DNA virus. This is the genome of hepatitis B, partially circular double-stranded DNA virus. All others are RNA viruses. All others are RNA viruses. Next, route of transmission. Hepatitis A and E is fecal-oral route, that is by having bad food, fecal-oral route, versus hepatitis BCD, which is IV drug abuse, sex, or parenteral route of transmission. IV drug abuse, sex, or parenteral. Lastly, frequency of chronic liver disease. Frequency of chronic liver disease. A and E never. We do not get chronic liver disease by having dhaba food. By having bad food, we do not get chronic liver disease. Frequency of chronic liver disease with hepatitis B is less than 5% versus 80% with hepatitis C. So highest frequency of chronic liver disease is with hepatitis C virus. Hepatitis D is a parasite on hepatitis B. You know this, it forms the surface. D is a parasite. So hepatitis D virus causes infection by two means. Co-infection, that is B and D occur together. Co-infection versus superinfection. You tell me, when will frequency of chronic liver disease be higher? When both B and D occur together? Yeah, when liver is already damaged by B and then D occurs. Superinfection, when liver is already damaged by B, then the frequency of chronic liver disease is 70% versus 10% with co-infection. This was the master table of hepatitis. The only DNA virus, double-stranded circular DNA virus, hepatitis B virus. This was the master table. We had a look at 3 things: the genome, the route of transmission, and frequency of chronic liver disease. Next question. Synthesis of DNA, S phase. Synthesis of DNA is seen in S phase, synthetic, or the S phase. Which are the two cell cycle checkpoints? Which are the two checkpoints? Again, when we were doing neoplasia cell cycle, I was so particular that we have to know cell cycle. There are two checkpoints, G1S, G2M. Which is the main cell cycle checkpoint? G1S, that is end of G1. There are 5 phases, G0, G1S, G2M. G0 is the quiescent phase of cell cycle. It is the quiescent phase of cell cycle. Stable cells are present in quiescent phase. Cells are of 3 types, labile, stable, permanent. Stable cells are present in quiescent phase. Stable cells are the ones which divide under stress. Stable cells. Next, tuberculin test. I was always after your life. Which is tuberculin test or Montox, in which purified protein derivative 0.1 ml PPD is injected in forearm, and we look at the response after 2 to 3 days, 24 to 72 hours. It is type 4 hypersensitivity reaction. PPD, it is type 4 hypersensitivity. Tuberculin test, it is type 4 hypersensitivity. We look at the response 24 to 72 hours after exposure. ठीक है, मान लिया. What is type 4 hypersensitivity? That is the cell mediated or delayed type of hypersensitivity. It is cell mediated immunity. So when you are studying path micro, you are never going to be asked 2 tough questions. The questions will be simple, straightforward. I actually want you to comment. Are you finding the questions very tough? Yeah, are you comfortable with them? बच्चे path and micro ना हमेशा अपनी नैया पार कराएगा. They are always the ones which are going to give stability to your marks. Condyloma acuminata. Another question on HPV. I want you guys to comment on this or write it in live chat or write it in comments, but I want your input. Condyloma acuminata. It is associated with HPV, human papilloma virus. Low risk HPV, that is HPV 611. We can divide HPV into low risk, that is HPV 611, and high risk. Which is the most high risk age group? 16, 18, 16, 31, 33, 45. Dhoni is on 45. He hits a 6, but it was a no ball. 52. He again hits a 6, 58. These are the high risk HPV. Which has the strongest association with cervical cancer? Which is the most mature age? HPV 16. 70% cases of squamous cell carcinoma cervix. 70% cases of squamous cell carcinoma cervix are associated with HPV 16. Fair enough. So condyloma acuminata, low risk HPV. HPV 611. 611. EBV we have already seen. Epstein-Barr virus. These are the exact options which the exact paper was given by the officials. These are exact options. There was simple one-liner questions. HHV 8, same option. The one with Kaposi sarcoma, primary fusion lymphoma, Castleman disease. EBV, nasopharyngeal carcinoma. Hodgkin's lymphoma. Which non-Hodgkin's? Burkitt's lymphoma. And last question. Resistance of Staph aureus is due to. You know there is penicillin resistance because there is an enzyme that destroys penicillin. There is elaboration of an enzyme that destroys penicillin. I'm not even getting into MRCA, methicillin resistant Staph aureus and all. Our target should be marking the answer right. That is what is important. So on this positive note, this takes care of path and micro discussion for the Rajasthan MO exam. Irrespective of the result, things are going to work out extremely better than what you think they will, firstly. And we are together in this journey. We are actually together. So do not worry, do not overthink too much. I know while studying, वो हमेशा feel होता है कि why is this happening with me? Things are not working out. I'm working hard and all. We always feel like this. But this phase is going to be over very soon. Keep on working, keep on slogging, and we are together. Thank you and take care.